Another myofascial release area that we can use commonly in a clinical situation is the popliteal fossa in patients who have fullness in the popliteal fossa and pain secondary to Baker's cyst, gastrocnemius problems, hamstring problems, etc. And we can do this either in the superior popliteal fossa or the inferior popliteal fossa. These techniques are also sometimes described as LAS techniques, but this is a direct myofascial release example. What I'm going to do is take my fingers, medial and lateral, and I'm going to come underneath the popliteal fossa until I can sort of feel them approximate in the mid-popliteal fossa region. Then I'm going to curl my fingers up, which bends the knee slightly, and then just curl the fingers so I can hook those tissues, draw down towards the foot with that curling motion, and my lateral hand is going to pull laterally, and my medial hand and fingers are going to pull medially with a reasonably moderate force, and just hold that tension at that direct bind barrier and wait to see if it releases. This may take 15 to 20 seconds, and as long as it continues to release, you can keep holding the pressure. And there is no on and off aspect of this, it's just continuous. And then once it doesn't feel like it creeps any longer, then you can let go and then see how that feels to the patient. Now, if they have a problem with the gastrocnemius and the lower hamstring, as you do this and feel these things release, you can use not just the palpatory tissue texture qualities, but if you would examine straight leg raising, for example, you can do this and then redo the straight leg raising, and it actually might have improved the straight leg raising as long as it was a lower hamstring or gastroc etiology to that. So a direct myofascial release to the popliteal fossa.